have you all people here, distinguished speakers, the chairpersons, the moderators, and the panel members. Uh, it's the requirement of the day that the new development in the medical knowledge, they must, go to the last person in the medical community. It must percolate to the rural, doctors, to the urban doctors, and the people who are staying in the remote places also. The development in the medical science, whether that be the understanding of the disease or the diagnostic modalities or the treatment protocols, they are evolving day by day. And it's very important that we understand and we really talk about these. This is possibly the first of its kind that we are having a multi-specialty approach as far as this CME is concerned. Now, this is first of this kind, the endeavor by the GASTRO LIVER HOSPITAL in association with Solaris, which is a division of the Sun Pharmaceutical. I also welcome the delegates who have come from Etawah, Banda, and Fatehpur. I am of the opinion that the knowledge they will gather with this CME will certainly benefit them all. Today somehow is the match with New Zealand, and that's the final match. So people are very much interested in the scores and what's really going on. That may hamper our gathering, but nothing, that is beyond our hand, because when the program was planned, this match was not in the picture at all. So we just looked into that this does not clash with the marriages. So we looked into the dates, but this was absolutely unfortunate that it fell in the same day. So now on, I request Dr. Ranjana Yadav to take over.
I'll now welcome our chairpersons to please come on the dais. Dr. Richa Giri ma'am, please come on the dais. Dr. Richa Giri is Vice Principal and Professor in Medicine, GSVM Medical College, Kanpur. She is Vice Chairperson of UP API and Chairperson of UP API Kanpur branch. Dr. Richa is Member Expert Committee Coordination Cell DGCI. She has special interest in endocrinology and thyroid dysfunction and over 100 research publications in national and international journals and guided more than 70 theses. Please welcome Dr. Richa. Next, I would like to invite our chairperson, Dr. Nandini Rastogi. Dr. Nandini is a senior consultant physician and diabetologist. She served as Short Service Commission Officer in Army Medical Corps. She was also awarded the Seva Sena Medal for Meritorious Services. She is Chairman Organizing Committee KDA Con from 2016 till date. She was awarded Nari Shakti Award in 2019 and Ratna Award in 2022 by IMA Kanpur. She is an active member of ADA, EASD, AACE, API, UP API, RSSDI, HSI, UPCSI, ISCM, ISCCM. Please welcome Dr. Nandini. Next, I would like to invite Dr. A.K. Trivedi, sir. Dr. Trivedi has worked as Senior Consultant at CMC Vellore. He did his DM Cardiology from GSVM Medical College, Kanpur. He is Chief Consultant and Director of Department of Cardiology, Regency Healthcare, Kanpur. He is practicing in Kanpur as interventional cardiologist for more than 46 years. Please welcome Dr. Trivedi. Next, I would like to invite our chairperson, Dr. A.C. Agarwal, sir. He is a senior consultant in internal medicine and diabetes. He did his MD medicine from GSVM Medical College, Kanpur. He is chairman scientific subcommittee IMA Kanpur and president Kanpur Physician. He was past president Kanpur Physician Forum and IMA Kanpur, KDA. Life member API, UPDA, RSSDI and Cardiology Society. Professional member ADA. Please welcome Dr. Agarwal, sir. Over to you, sir.
Again, good afternoon. As far as this program is concerned, it's definitely a multi-specialty program. It will be covering neurology, nephrology, gastroenterology, respiratory medicine. So now I'll request Dr. Nandini Rastogi to say 2 words that how far this is really needed in the city.
Respected seniors and dear friends, it's an honor to be here this afternoon, because in spite of the fact that India is bowling and New Zealand is down by 2 wickets, 3 wickets, sorry, thank you for the correction, 3 wickets. I was actually doing multitasking. I was answering questions on a webinar till about 10 minutes back. So thank you, Dr. V.K. Mishra and Dr. Shripad and Shubhra for having this clinical update, long overdue from an academic person like you. And now the Gastro Liver Hospital is producing this academic event. Obviously, multi-speciality, as internists, you know, we want to learn more. We cannot be super specialists in every branch, but everything little that we pick up from these clinical updates, it's of great use in our clinical practice. And finally, that is what we want to do, is to improve the outcomes in our patient. I'm not an academician, but yes, clinical updates are very important, and thank you for having us here.
Thank you, madam. Thank you, madam. Dr. Richa Giri, please.
Good afternoon. Respected seniors and all the delegates, speakers, chairpersons, and the moderators. Now, it's a great privilege to be a part of this first clinical update, which is being organized by Gastro Liver Hospital in association with Sun Pharma Solaris. And this is a new concept that the pharma company, they are bringing down all the great speakers under one roof, and the eminent speakers will tell us about the recent in neurology, gastroenterology, nephrology, and endocrinology. And I must congratulate Dr. V.K. Mishra, Dr. Shripad, and Dr. Shubhra for organizing this update. Thank you.
Dr. A.K. Trivedi possibly is the first cardiologist in the private setup. One of the leading cardiologists, very senior, well learned, and with lot of wisdom. I'll request Dr. A.K. Trivedi to come forward.
Lot of wisdom.
Lot of wisdom. Even the ball wisdom.
Even the ball show it. Yes.
At the outset, I'd like to give thanks to this Sun Pharma Solaris division who have organized this CME program for the first time in the city as a first clinical update by Gastro Liver Hospital. And he has chosen the best program director of the town, Dr. V.K. Mishra. I must congratulate him for starting this work again here. डॉक्टर वी.के. मिश्रा जब यहाँ अपनी ससुराल आए थे डीएम एंडोक्रोलॉजी करके, तो इनके दिमाग में बहुत सारे शहर घूम रहे थे कि हमें कहाँ सेटल होना है। ये अपनी मेहमान नवाजी करवा रहे थे अपने ससुराल में, तो अचानक इनको टहलते हुए कोई डॉक्टर मिल गए, जिनसे मिलने के पहले ही इन्होंने सोच लिया कि चलो इनको हम बड़ा भाई मान लेते हैं, ये जैसा कहेंगे वैसे हम आगे बढ़ेंगे। फिर ये उनके पास गए और उनके पास से जब लौट के निकले तो उन्होंने डिसाइड कर लिया कि हम अपनी ससुराल कानपुर में ही बसेंगे। और उसके बाद इनका ग्राफ ऊपर तक चलता चला गया और सबको पता ही है कि द हाइट्स व्हिच ही हैज अचीव्ड इज़ वेरी डिफ़िकल्ट एंड लोग तो इनको फादर ऑफ गैस्ट्रोएंटरोलॉजी ऑफ कानपुर कहने लगे, बिकॉज ही वॉज द फर्स्ट पर्सन ऑफ गैस्ट्रोएंटरोलॉजी टू एस्टेब्लिश दिस ब्रांच इन कानपुर। फिर इनको कानपुर वालों ने बहुत प्यार दिया, बहुत सम्मान दिया, इन्होंने अपना क्वालिटी वर्क दिखाया यहाँ पर, क्वांटिटी तो नेचुरली बढ़ती चली गई वर्क की। और फिर ये भी कानपुर को इतना प्यार करने लगे, इन्होंने कहा कि हम 2 स्पेसिस और देते हैं। इन डॉक्टर शुभ्रा और श्रीपद को भी कानपुर को सौंप दिया फॉर ए गुड क्वालिटी वर्क। आई विश देम ऑल सक्सेस इन देयर क्लिनिकल एंडेवर एंड दिस CME I hope is going to be very, very useful for the patients which are being treated by all of you. Means this knowledge goes on and thousands and lakhs of patients, they get benefited through all of us after attending this sort of CME. So I wish grand success for this program. Thank you, Dr.
थैंक यू डॉक्टर त्रिवेदी। वो डॉक्टर जिनसे मिलने के लिए मैं 1988 में गया था, जो खुद भी प्रैक्टिस अभी एस्टेब्लिश ही कर रहे थे, वो डॉक्टर त्रिवेदी थे। मुझे लगा कि एक कार्डियोलॉजिस्ट प्रैक्टिस में बैठने की कोशिश कर रहा है तो मैं भी बैठने की कोशिश तो कर ही सकता हूं। तो ही वाज जस्ट कमिंग आउट ऑफ द क्लिनिक एट अराउंड 8:45 और आई जस्ट एंटर्ड। तो उन्होंने बोला कि कौन हो, अभी तो टाइम खत्म हो गया। मैंने बोला नहीं मैं कोई नहीं हूं, मैं जरा कुछ सलाह करने आया हूं, बैठिए जरा। And then we discussed, and then he said कि इससे गंदी सिटी कहीं मिलेगी नहीं, गेस्ट्रो प्रैक्टिस यही करो। Now I request Dr. A.C. Agarwal. Dr. A.C. Agarwal is a very senior physician and has been in the command of that medical practice in the city for very long. Dr. A.C. Agarwal, please.
Thank you, Dr. V.K. Mishra, for your nice words. Friends, it is a proud privilege of Kanpur city that we have a gastro liver hospital, where all type of facilities regarding gastro and now cardiac management are available. It is very difficult to organize a CME like this and with so many specialists as a part of it. And what the mind does not know, eyes don't see. So we as physicians, we should know all the subjects, all the aspects of various specialties, so that at least if we don't manage them, we are able to guide our patients timely and provide good advice to them. So I must congratulate Dr. V.K. Mishra and his team and Sun Pharma for making this event possible and making me a part of it. Thank you, Dr. V.K. Mishra.
Now, I'll request all distinguished chairpersons to come up for the lighting of the lamp. Dr. Shripaj, Dr. Shubhra, Nehru ji.
I'll now request Dr. V.K. Mishra sir to present memento to Dr. Richa Giri ma'am. Dr. Nandini Rastogi, ma'am. Dr. A.K. Trivedi, sir. Dr. A.C. Agrawal. He was awarded Kanpur Ratna Award by IMA Kanpur and Lifetime Achievement Award by IMA Kanpur. Please welcome Dr. Naveed.
अगर आप शेन मोहन की बात करें, मुरलीधरन की बात करें, इन्होंने कितने लेफ्ट हैंडर्स को आउट किया होगा, कितने राइट हैंडर्स को आउट किया। ये तो अच्छा कि जो गेंदबाज है ना, वो सामने बल्लेबाज लेफ्टी हो या राइटी हो, अच्छा गेंदबाज आपको तभी कोई मानता है जब आप दोनों।
Good evening, everyone in the hall. Respected Dr. Navneet Kumar Saab, respected teacher. I must congratulate the Gastro Liver Hospital and Sun Pharma Solaris Division for organizing such a beautiful CME. On this platform, today's our speaker is Dr. Navneet Kumar. Everybody knows him very well. In fact, he is a founder of neurology in Kanpur city. He is a professor of many professors in the city, and not only city but in all over India. So, and today's topic is very much common for everybody, and Dr. Navneet Kumar is particularly very, I think I would say he is a master in management of epilepsy and movement disorder. So today he would enlighten the current topic, current approaches in the epilepsy management. This is my humble request. Please bear with us for at least 30 minutes, followed by we will take question answer for 10 minutes. Thank you very much. Here I am for conducting and structuring the session in an informative manner. Thank you very much. Please, Dr.
My dear Vikas, the moderator, Dr. Varsha, Dr. Zubair, then my seniors, Dr. A.C. Agrawal and Dr. My contemporaries, Dr. Richa, Dr. Nandini Rastogi, the organizers, Dr. V.K. Mishra, Dr. Neeru Mishra, whose name I am not seeing somewhere, and then Shubhra and Shripat. Ladies and gentlemen, it is indeed a pleasure to be with you all to speak on this subject, a difficult subject, long subject, but I will try to make it concise in 25 minutes or so and give you tips to how to manage a case of epilepsy. Epilepsy is the oldest neurological disorder. It was described by Charak in Charak Samhita in our own country. Unfortunately, the credit has been given to Hippocrates for all these disorders because our Indian history has totally been washed out by British writers. The disease was basically, first of all, discovered, narrated, scripted by Charak. Now, epilepsy is a very common disease because 1% people all over the world are suffering with epilepsy. That would mean in our country we have 15 million people suffering with epilepsy, and Kanpur alone will be having 50,000